A natural med isn't just a substance you take. It is a lifestyle that one lives to amplify their health. We don't always choose how long we will be on this planet, but we can take action on the quality of life that we wish to enjoy.
The Natural Med podcast interviews different professionals and experts who look at improving the quality of health so they can live a more fulfilling life. Whether that be physically, mentally, emotionally, financially, or spiritually, we discover the secrets to their own journey and the small steps individuals can take on a daily basis to improve the quality of their life. Come with me as we travel, research, and discover how we can make incremental changes on a daily basis to live a more fulfilled and balanced life.
Hello and welcome back to another episode of the Natural Med Podcast. I am Nathan. I am the voice. And of course, that is Nicole Wright. She is the face of the company.
Hi.
And we are joined today by Dr. Crystal Frankel from Denton Sports Chiropractic. And we're so excited to get inside her head and see what she's got going on up there.
No pressure.
So welcome,
Thank
Crystal,
you.
to the podcast. So tell our listeners about yourself and what got you into chiropractic.
All right. Well, I guess I'll start with the personal stuff first. Like Nathan mentioned, my name is Dr. Crystal Hankel. I am a Canadian girl.
Yeah.
America's hat.
Exactly. I moved down here, in 2003. I moved to Texas. I was on a softball scholarship. So
Nice.
That's what brought me down here. I never thought I would stay in Texas, but yet here I am. Almost 20 years, so I'm aging myself. I played softball at TWU.
Oh, TW alumni right here.
Yes, yay.
That's awesome.
Yeah, so I loved it there. Had a great experience. Denton was much different and smaller, but it was awesome. Stayed, went to chiropractic school, graduated in 2010. Got a job with my mentor, which was awesome. Learned a ton. Noticed there was a big hole for like sports chiropractic in Denton, which is how I got there. But I guess otherwise, personally about me, is married to a Marine veteran, combat
nice.
veteran. He's a firefighter, paramedic. We have one little guy. He's 1.5. And then obviously anyone watching video can see I'm pregnant.
One on the way.
I'm pregnant again, due in
It's
October.
not a tumor.
Exactly. It's not a tumor. Yeah, I know. I'm like, oh boy. Yeah.
I'm done.
Yeah, Nathan just like mic drop, walks out the door. And then I guess a little bit about my business. Since we rolled into that, I opened it 8 years ago. We are right on the square. As I mentioned, it's Denton Sports Chiropractic. Specialize in sports, but what that means is like not everyone has to be an athlete. We just want people who are like active or wanting to seek out like more treatment, I guess, than traditional chiropractic. Right. So we still adjust people. We can get into some of that, but we also do a lot of soft tissue work. So our appointments are generally 20 to 30 minutes versus a 5-minute rack and crack, as we kind of joke.
Yeah.
And we do dry needling, Graston, which is a soft tissue modality, myofascial release, taping, cupping. I'm trying to think what else. We have a shockwave machine, which is really cool. Piezo wave. It's kind of like an ultrasound, but it's acoustic sound wave therapy. I got a sports massage therapist.
Nice.
And a corrective exercise specialist in-house.
That's awesome.
That's
we're doing a
awesome.
lot of really cool stuff. And I got 3 other doctors that work alongside me. So
Yeah, because that was interesting on your website. You posted something that said, or it's in your bio, that it's more than the spine.
yeah,
And
yeah,
I was
for
very
sure.
interested in seeing that.
Yeah, I think that's like a huge, well, I know we want to talk about misconceptions later, but
Yeah.
people think like a chiropractor's for back pain. And I like, even today I had someone who's like, my ankle's really hurting. I'm sure you can't do anything about that. And I'm like, but I can. Like, actually I can. So we check all the extremities, all joints, and then all soft tissue associated with the joints, because it could just be a tight muscle or, you know,
Yeah.
there's a lot of things that play into mobility. And I'm a firm believer that muscles move bone.
Mm-hmm.
So like if your spine's out of alignment and you don't address the soft tissue, then things aren't going to be moving correctly. So even if I adjust that spot, you're going to go sit in your car, sit at your desk, do whatever, and that muscle's still tight, so you're right back where you started.
Yeah.
And so we try and look at the big picture. see where we can help you out and give you a lot of things like tools and stuff to do on your own. So foam rolling, stretching, exercises so that you can be an advocate in your own health journey, because I don't want to just be like a pill.
Yeah.
Like you need to come see me all the time. I want people to have tricks in their toolbox to take care of themselves.
Yeah, that's awesome. That's good that you treat the whole person and everything, because it's super important. It's not, not just one thing or the other, as we've kind of talked about on this podcast. Like, it's treating the whole person.
Whole wellness. And honestly, I never really planned on starting my own business.
Yeah.
But in interviewing for people and looking around, a lot of chiropractors was like, you see 100 people a day, you see various, and I'm like, I don't think that's necessarily bad. People get good relief from that, but I'm like, I want to have time to visit with my people and treat the whole body and figure out what's going on. And so I was like, I guess kind of have to reinvent the wheel. Now tons of people are kind of doing this, which I think is really cool that chiropractic's moving in that direction. But
and you're a women business owner, and you have pretty much
we're all
mostly
female staff.
All
So there's
staff.
8 of us total, and I never again attention that, but it's pretty awesome.
Yeah, that's awesome. I love it.
Yeah, we have a lot of fun, and we
can
call it like
imagine.
the girl gang.
Yeah, that's awesome.
Yeah.
That's so cool. Yeah, it's so good seeing other women business owners and everything, especially here in Denton.
Yeah.
And it's, it's for myself, it's been very interesting, getting into the whole business owner thing.
Yeah.
And I'm sure you've been a business owner for now
8 years.
8 years. Yeah.
There's a lot of like things you learn, a lot of mistakes you make and figure it out along the way. It's funny. I was telling Nathan too earlier, I'm like, I was so excited to be on the podcast. And I'm like, I know so many people and friends have been on here, so now I'm part of the Cool Kids Club.
The Cool Kids Club. Yeah, that's awesome. Yeah, I love it.
Definitely happy to be here.
That's awesome.
So, I think you already answered the question about why chiropractic. How would you say DSC differs from other chiropractors in the area?
Kind of similar to what I was saying. Like most are just spine or a lot of only adjusting.
Right.
A lot of use passive modality. So people are familiar with like electric stem, like a TENS unit, rolly tables, things like that.
Yeah.
We have an electric stem unit, but we hardly use it. We're very hands-on. Longer appointment times. People are going to be in our office for 30-ish, maybe a little bit longer, depending on treatment. Very specialized care, one-on-one, and then tons of soft tissue work. So I always joke, it's kind of not massage, but you'll get that piece of it with your chiropractic. And we have tons of tools in the toolbox, so we don't just always have to use the same thing for people. Like some people are like, well, I don't like acupuncture, dry needling. I'm like, I don't have to needle you. I can use my Graston tool, or I can use cupping. And so people are kind of worried, oh, if I come there, I have to get that. And I'm like, I'm not going to do anything you're not comfortable with. That even goes for adjusting. So I know a lot of people, if they go to chiropractor, are like, I'm not comfortable with that, but that's what they're going to do. I'm like, I'm going to do whatever I can under your like comfort umbrella to make you feel better. So we have lots of tricks up our sleeve.
Along with this, real quick, let me ask you. So on YouTube, there are a ton of chiropractors. They do those cracking like ASMR and stuff like that. Okay, great. But
did you say ASMR?
Yeah, they'll do that for ASMR.
Are you serious?
Oh, yeah.
Oh, okay. Like Interesting. What kind of videos
I like think
are you
of watching? The King of Cracks is the one that always like pops up on my like feed. King of Cracks.
So there's a couple of different chiropractors that will do that bracing around your neck and then like do the I can't remember
Y
what they
strap.
call it. Yeah. So what are your thoughts on something like that?
I've done a lot of research. I don't want to like poo-poo it because I have a lot of friends that use it. Yeah. I'm personally not a huge fan, only because like you see people when they pull on it, like their whole body like lifts off the table essentially. Yeah. So you just take the specificity out of it. So if someone's locked up somewhere, I can't like know for sure I'm moving that joint because I'm using a tool. So I feel like it could stretch out a lot of ligaments. I can do a little bit of that manually with my hands and have control over what I'm doing without like yanking people with a strap. But so it's not my forte. I will never use it in my office, but I know
safe, unsafe. How would you rate it?
The company says it's safe. I should probably leave it at that.
Fair enough.
Yeah. I've heard mixed reviews. Like I said, people love it. It's just not my cup of tea in terms of treatment for people. I think it's very cool for show and for YouTube and TikTok, and that's what's got a lot of traction. Yeah. People want to try it. I don't think it's the best thing for you personally.
Yeah, it sounds cool too, but
I mean, if you want to be like levitated off the table by.
Here's the thing, because the only reason I ever even started watching those is I dealt with my own issues.
Yeah,
and when they do that to people that have these major issues in their back, they're like, oh my gosh, I feel so much better. But I've been to a chiropractor enough to know that you feel so much better for about 5 minutes.
Yes.
And unless it's just a continuous, staying in good health, it's going to keep going back to where it was.
Yep.
So anyway, just wondering what you thought about that.
Yeah, that's interesting.
Yeah, so you offer a lot of different treatment options like the dry needling and massage therapy and everything. And tell us about some other things that patients can use. I know you have some CBD products in your
Yes. So
clinic.
we obviously love CBD. We carry a lot of supplements, foam rollers, like lacrosse balls for different soft tissue work, is mainly just things for like overall wellness. I can definitely touch on why we love CBD since we're on that topic. One, y'all's muscle cream is the best muscle cream I've ever used.
Yeah, we know. I
know. Like it literally is the best, but also I tell my patients a little goes a long way. You only need like a pea-sized amount, so that tub lasts forever, which I think is amazing. And just the relief of the analgesic of the topical ointment plus the anti-inflammatory is awesome. So we use that, like the Graston tool is a little scrapey tool. It's called iStem also, which is instrument assisted soft tissue mobilization. It's a mouthful, but it's using a tool. So the nice thing is we can use a little bit of that CBD cream, get it into people's skin as we're working the soft tissue. So we use that probably a lot, or just with manual stuff, but great for sports injuries, inflammation, recovery. We also love the oral stuff for a lot of our athletes who are just having trouble with sleep recovery issues. So definitely big fans of that. I'm a big fan myself for sleep. I'm currently not taking any, but
that's awesome. That's good to hear that it's helping your clients and everything. And I know our customers love it here with the muscle cream. That's probably one of our top sellers.
Yeah. So. And there's tons of research that I read too, just with cannabis in general, with recovery from sports injuries, especially concussions and football players. So I'm definitely a big proponent of that.
Yeah. I, Texas, we're kind of limited. I know for the medical marijuana program they have in Texas, it's pretty limited on the diagnosis with like seizure disorders and PTSD and only a few other things. But, hopefully in the future, fingers crossed, there'll be more, legalization in the state and nationwide and everything too.
Yeah, I hope so.
Yeah. Canada, where you're from, I'm not sure. Is it legal there?
It's legal.
Oh, it is? Okay.
So I think as USA started legalizing things, Canada typically is a little bit ahead with their just more open to that kind of stuff. And so they took a while to get more like edible gummy type products with both CBD and pure THC cannabis, but they're completely legal across the country. So
that's cool. That's awesome. Yeah. What is does the like chiropractic group have any I guess kind of like thoughts on legal, like medical marijuana and everything?
No, I think it's probably like everything, especially the Texas Chiropractic Board. You have a mixed
reviews,
mixed bag. I feel
everything.
like a lot of chiros like CBD products. They think it's helpful. A lot of them carry CBD products, but in legalization, I haven't heard much, and it kind of seems to go like a political issue more than a professional issue.
I've seen that too with like the Texas Board of Nursing and everything, even though you have nursing associations that are coming about, like the Cannabis Nurses Association and everything, and they're very for it because there's a lot of states that marijuana has been legal, and a lot of patients really benefit from it for like cancer and chronic pain and seizures. And
it's great. Well, and like even for my hubby, like being a veteran with PTSD and with his job sleep stuff, it's like I would love for him to take those products, but being a firefighter medic, then there's
get
like
drug
testing,
tested
so
everything.
he even has to be careful on like what products he is taking, which makes me sad though, because I'm like, that would be such a huge benefit just for his overall health.
Yeah. Oh yeah, for sure. And definitely less side effects than a lot of prescriptive medications, so that you can get a prescription for, and as long as you have that prescription, usually your company's fine with the drug test, but with cannabis and medical marijuana, it's like, they're just, everybody's still trying to figure it out.
And you just don't know, or you don't want to take the risk because it could affect your job.
Yes. Yeah, for sure. Definitely. Yeah. With drug testing and stuff, we usually tell our customers the isolate or the terpene infused or topicals are okay.
And I've loved that you guys have educated me on that too, just for stuff at the office, because then we have patients too that I know their job, or they're worried about potential testing for employment typically reasons. And I'm like, well, these ones are safe. You can take these. This will still benefit you. These other ones are also great, but but you're more likely to have a positive drug test. So it's really great in order to help guide them on which products to use. So.
And college athletes too, they get drug tested.
We even teach, or like not teach. We work on tons of like pro athletes, particularly like cyclists and stuff, and that's they're being tested all the time. Even supplements that we carry, I have to be really careful on what they take because
it can
there's
pop positive for different drugs and everything.
So they just have to be super careful. So it's nice to have a little insight on that. I'm very thankful for you guys.
So knowing that you are CBD friendly and your clients are as well, do you notice a difference once, say, a client starts using CBD? Do you notice a difference in being able to work on them? Is it easier? Is it more effective since they've started using CBD products or anything?
Yes, I think that's like, I mean, I could go into a whole bunch of reasons for that, but even like, I mean, even if people are taking CBD, if people are taking CBD and they're sleeping better and they're recovering, their tissue is going to feel different just because their body is recovering. So even that alone is a huge difference. But in using the lotions, like people have quicker results. You know, they leave the office feeling better. A lot of them, sadly, don't just attribute to that. And granted, we're doing a lot to them. Like I even tell them, like, you won't even know if it's adjusting or soft tissue work. But if you're feeling better, why does it really matter? But I think the CBD just adds another layer to that. And in their process of feeling good. So just helping inflammation and pain. And
yeah, that's awesome. So in talking about being healthy and everything, what does a healthy lifestyle mean to you?
Oh,
I know it involves a lot, you know, and some people, they have multiple different things that
I think like, this sounds really basic, but I think like, just general health is being consistent with a handful of things. Drinking enough water, preferably with some form of electrolyte, especially with this Texas heat. Getting consistent exercise, and it could be 30 minutes of walking a day. I think strength training, people should be strength training, but I'm like, there's a bunch of stuff that people can do with what they like that helps with their health. Eating a good diet, getting 7 to 8 hours of sleep, meditating and having a gratitude practice, like mindfulness is probably the top of the pillar, as I know you guys have talked about a lot on the podcast, but without your mental health, then, so I think like if you just get consistent with those few small things that are very doable within your week, that's a good step towards overall health and wellness. And then you can go a lot of places from there, but that's a good baseline.
I love that. I love that it's a good variety of different things, that you have to be well-rounded in a lot of things. Because I think that's missed for some people trying to get healthier and get, feel better and everything. And they focus on, okay, I'm just going to work out 30 minutes every day. And then they still go home and they don't eat good and they don't take care of the
sleeping.
stress.
They're like sleeping 4 hours a night. And
And that's a hard one too, because when you're trying to get healthier and you're like, okay, the only time of the day I have to work out is super early, and then you're missing out on sleep, and then you wonder, okay, what's worse?
Yeah, it's like hard to find that balance. And I even see with a lot of my very high-end athletes, a lot of like, yes, they're very healthy, but there's also too much. You know, if you're training a couple times a day and not fueling yourself properly and your adrenals are maxed out, like that's not healthy long-term either, because you're going to have hormonal effects with that. So making sure you're supported. So you can support that with sleep and CBD and mindful, like you can shift that back, but you need to find some balance. So I think for general public, like hitting that baseline is a good place to start, at least in your overall health. And then you can do other self-care things from there.
Yeah, that's awesome.
Yep.
So are there any misconceptions about chiropractic that you'd like to
There's
clear up?
lots of misconceptions about chiropractic. I'm like, where to begin? I'm sure you guys can think of tons. I think the biggest one that I wanted to talk about, we briefly touched on this, so I think it's a good place to start, is that people think, I always hear, well, I don't want to go to a chiropractor because if I go once, then I need to go for the rest of my life.
Right.
And my answer to that is you don't. You can like go for a quick get out of pain. So you have a crick in your neck or your back, like that will make you feel better. But then I also question like anything in health, like if you just eat good one day or you only work out one day a month, healthcare is cumulative, or health in general is cumulative. So if you're not doing things on a semi-regular basis to benefit you, that's kind of where chiropractic as a maintenance thing comes in. Now, I will say about our office, traditional chiropractic is going in, seeing someone 3 days a week. A lot of people get scared by that. And like, you need to pay $4,000 up front for this treatment plan. I'm not a believer in that. We're very much like, I'm going to see you once. If it's an acute injury, I'm probably going to see you again the next week so I can see how you're doing and make some kind of game plan. And then from there, I might just see you once every 4 to 6 weeks, because that's ideal for us, is maintenance care, trying to prevent injuries before they happen, but also keeping up with like imbalances and stuff in the body. So I think being in the sports world, that's key, because we want to prevent some of that from happening. But I don't think that it's an all or nothing type thing. You can go and reap the benefits. And I always use an analogy as like getting an oil change on your car. Like if you never check the oil on your car, eventually you're going to fall apart. And so chiropractic's kind of the same thing, in my opinion, is you go in, you get checked out, you get a little tune up. Hopefully someone's educating you on what you need to do to take care of yourself. And then you can keep up with it as much as you want. And I think we have people too that, like athletes, they come in once a week because they're training like crazy, and it's during season, so it's more important for them to come in all the time. Or people who just don't want to take care of themselves, which I'd prefer they foam roll and stretch and be active and not need me all the time, because then I'm doing my job and educating them. So we see it across the board. We have some people too who just want to be in 3 times a week and not do anything for themselves, which I'd prefer they go see someone else if they want that. Personally, one, because I don't have the time, but two, it's just not the vibe we have in our office. Like self-care is a big part of that, and we want people to take care of themselves and be an advocate for themselves, and not just do something because I tell them to. I want them to research it and know that they're benefiting their own body. So
yeah, that's awesome.
Yeah.
So you're kind of talking about a lot of people think that you just work on the spine, but really you treat a lot more on the body. Kind of go into that a little bit more, and what does that involve and stuff?
I say at our office, the biggest things that we see more than even spinal thing are like plantar fasciitis, elbow tendonitis, shoulder pain, impingement, rotator cuff issues, jumper's knee, like typical athletic type stuff that people are at a loss. Like, where do I go? I tried PT. These exercises aren't helping. Things like that. So really anything you can think of. We do a lot of headaches, migraines, even like hand stuff. Cause now with society, everyone's at the computer typing, mouse hands, texting. So thumb, wrist.
Yeah. Yeah, there's a lot of other injuries that people are getting and everything.
Yeah, like all the new diagnoses in the ICD-10 code book about like tech neck or apple neck. And
what about, did you ever get anybody for
Yes.
I made that up.
Yeah, no, that's a thing. Definitely gaming. That's a thing. So a lot of it's just honestly overuse injuries. Yeah. That's why I tell people, you do anything cumulatively for a long period of time without like stretching properly or doing anything to counteract that, you're going to have some repetitive stress, and that just creates inflammation over time. So
yeah, that's good to know though. That's good to know that, not just the spine, but y'all look at and treat other parts of the body, which is super important, especially when it comes to sports and everything.
And even like, I mean, I've studied a lot of nutrition, probably even more so than other people in my office, but I think that's key too, like asking people, what are you eating? Because if you're having an inflammatory reaction from other foods, we also treat tons of like autoimmune patients, not necessarily like I will refer them to functional medicine people if they're having a specific flare up, but that's another good thing for CBD, but they might be having chronic pain and they could be overdoing it, or, they're just putting bad foods in their body. And so I'm like, well, why don't we look at some of that and in conjunction and see where you get, because it's overall health. And I'm very quick to, and I push all my team to be this way, but refer to other practitioners. Like I am not a one-stop shop. I don't know everything. I want to work with other people in the community to provide people the best health care possible. And Nathan and I were talking about this earlier too, just supporting other small businesses and other people. I'm a huge advocate of that. That's why I love carrying like y'all's products, similar type stuff in the office, and then referring to other local people who are crushing it and helping people. Because I don't need you to spend all your money with me if I'm not helping you. Like, go see a PT or a different healthcare provider that's going to offer that. Sometimes it's therapy. They think I'm their therapist. I am not their therapist. This is a funny story. She's actually a friend of mine, but she was telling me a bunch of stuff one time during an appointment, and I was like, have you ever like seen a therapist or a psychiatrist? She goes, no, you're it. And I'm like, no, honey. And she's like, no, really? And I'm like, no, that's like out of my pay grade. And also like
Crystal does it all.
Yeah, and it's kind of like the hairdresser. Like everything gets dumped, especially when we have longer appointment times.
Yeah.
It's kind of fun. You get to know people. People become friends. They're all my family.
Yeah.
But I'm like, that is not my job. I will give you the best advice possible, but that is not my job.
That's awesome.
Yes.
That's cool.
Yeah. The office is kind of like, if these walls could talk.
Yeah, if these walls could talk. That's awesome. So kind of talking about like inspiration and everything, it's kind of a different question we asked, but if you could meet somebody non-living or living, who would it be and why?
I think that's one of those questions too. I could probably list 100 people that I'd want to meet. I think the first person that comes to the top of my brain is David Goggins. I don't know if you guys have heard of him. He's got a really incredible book, but he's a former Navy SEAL.
Okay.
And he does like motivational stuff, but his biggest thing is just on like work ethic and determination. So he comes from a similar background as my husband, like poverty, a lot of abuse, that kind of stuff. And so he's overcome all of these things and now is motivating people like all over by just inspiration of being healthy. And you know, like sometimes it sucks to get up, but you can get up and walk 30 minutes and things like that. So loved his book. I'm always listening to some of his stuff just I think it's a good reminder, like
that's awesome.
We just have this one day and you can get up. And I know even in Sarah's podcast, she was talking like pick goals for that day. And I was like, that's the best advice anyone can give, because like really, if you're looking too far out, you're not going to accomplish anything. It's overwhelming. So just picking that one thing that you can work on that day and knocking it off your list and you know, doing your best. And if you fail, so what? Start over the next day.
Start over. Yeah.
He's very in line with a lot of that stuff. And I think that's powerful. We
awesome.
need people like that preaching.
We do. We need that inspiration.
I need Sarah like in my back pocket every day. Like
she's so awesome. She's such a good like inspiration and coach and everything. And I know I work with her a little bit. Oh yeah. Just following her on social media.
She's like a little cheerleader.
We love you, Sarah.
Yeah.
Shout out to Sarah Schroeder.
I was telling Nathan too, I'm like, I feel like I'm a bubbly person, but I'm like, I don't even like cut the cord compared to Sarah. So.
Oh yeah. So speaking of like inspiration and tips and everything, what's something that you can give our listeners, like a tip that they can do, just a little something every day to maybe improve the overall quality of their health?
I really think it's just stuff we talked about, like start with like making sure like your water consumption is good, you're being active, you're eating mostly non-processed foods, you're like practicing mindfulness, all those things. I think that's the key. And then from there, it's like, what are you doing for your self-care? It doesn't necessarily have to be chiropractic, but like, are you doing some kind of like yoga or soft tissue mobility, like stretching out your muscles, moving your body in that form with breath? I think breath that's like, speaking of wellness, that's a huge thing. Like most people I treat don't know how to breathe properly through their diaphragm. They're very constricted from stress. So taking time to like belly breathe, really like be present with yourself and taking a second is a huge game changer in overall health. So I would start there. And then I think like doing some massage or chiropractic or PT, those kinds of things too are like added bonuses, but
yes, definitely. I love it. Such good information.
Thank you.
I love it.
Cool.
So we're at the end of the podcast.
All right.
Tell us a little bit more about you and how we can reach you, your socials, things like that.
You got it. I have my own personal social, which is just Crystal Hankel on Instagram, Facebook. You're mostly just going to see pictures of my kiddo or reshares of the business because all my social media presence goes into business. But Denton Sports Chiropractic is on Instagram, Facebook, TikTok, and then you can check out our website, dentonsportschiropractic.com. Email the office if you have any questions.
And y'all are right off the square.
Yeah, so for people from Denton, we're in the old Hypnotic Donuts building.
Oh,
R.I.P.
Yeah.
My husband was very upset, but I'm like, I didn't close the donut shop. It was for lease. Like he's a major health nut. Yeah, he's such a health nut, but donuts are his. He's like, how dare you? I'm like, they were already gone. This is not my fault. But yeah, we're right downtown, so that's super fun atmosphere.
Awesome. Yes. Well, thank you so much, Crystal,
Thanks
for
for
being on the
having me.
podcast. This was so much fun. And
Yeah, I loved it.
So before you go, Doc, I got this.
you got this little crick in your back.
arm.
He had to throw that in there.
I know. He
I
prepped me.
warned her.
Yeah.
We'll see y'all next time.
Awesome. Thank you.